Outline of a sagittal section of a segment of the thoracolumbar spine highlights the burst fracture of a vertebra. Note the proximity of adjacent nerve roots. Following a formal posterior approach to the involved segment of spine, the fractured vertebra is exposed. Pedicular screws are inserted into the upper and lower vertebra, and a temporary rod is fixed contralateral to the corpectomy side in order to stabilize the spinal segment. Then, a laminectomy from the more affected side is carried out, followed by partial corpectomy until the thecal sac is fully decompressed. This stage ends in a clean cavity within the fractured vertebral body with exposed upper and lower end plates. An appropriate size mesh cage is chosen and placed freehand onto the damaged vertebra, perpendicular to the spine long axis, between the caudal and cephalad exiting nerve roots. The cage is now carefully rotated with a right angle clamp to be set parallel to the long axis of the spine. Damage to the nerve roots is thus hindered or minimized. The cage distractor is now engaged. Before expansion of the cage, the rod set screws are loosened. At this point, the cage is gradually expanded towards the upper and lower end plates. The distraction process ends when the cage reaches maximum stability and full contact with the end plates. The rods are then tightened in compression to completely restore the sagittal alignment of the injured segment.